Okay, guys, welcome back to another episode with Lately with Lex. Today, I have a friend of mine on here. We met about a year ago who is newer to the industry. Joss, I'm so excited to have you on.
Thank you for having me here.
So tell us a little bit about you and give us your background, and then we'll kind of go into all the fun questions.
Yeah, so I've been a nurse since 2014. I own my business in Danvers. I moved it to Danvers from Peabody.
That's really cool.
Last
You
year.
just did that, right?
Yeah, I just did that. I expanded into a bigger, larger space. And I went into aesthetics in 2022, mom brain, after I had my daughter.
That's like difficult, opening a new business, a brand new baby.
6 months postpartum, and thought it was a good idea to open a business.
I mean, I did the same thing.
So, here we are.
Rough.
Trying to make it work. Yep.
So what made you leave beds? Like what you were doing bedside nursing? Like what were you doing before? Were you
Case management.
Okay.
So I was doing case management. Yep.
How'd you get into that? That's different.
I actually started my nursing career at MCI Framingham. So I was a correctional health nurse. That was like the only job I could get after school. Nobody would hire me. I was a first generation college student and had no connections anywhere. Wow. So I applied and no one would hire me.
And a jail was
At
like,
a
we'll take
prison.
you.
Yeah.
Oh, a prison will take
Yeah,
you.
prison.
How was that? Let's talk about that. Like you must have some crazy.
Can I swear?
Absolutely.
Well, the first time I ever got called a cunt was
What?
at MCI Framingham.
No way.
Yeah.
So like is it like people being stabbed and stuff and you're calling 911 to get them taken away? Like give us like a little like.
So I worked in the infirmary before I worked in the psych unit, before I worked in the pre-release. So the infirmary is where everybody comes in, if they're like detoxing, they just came in from the, what do they call it? Like the county jail or something, like they
Like a
violated
transfer.
parole, probation, whatever, things like that. And so they would come in detoxing. And so that was the medical unit. Or if someone was like severely sick or an elderly, inmate or patient, as I learned to call them, they're still patients. And
Was that difficult for you to to be, I mean, like, I'm sure you know what some of their crimes are, right?
Yeah.
So like say you have someone that is completely morally against everything that you've ever believed in and you're like trying to save their life or trying to help them. Have you ever had a moment where you're like, why am I doing this?
Absolutely. Absolutely. But at the end of the day, it's like they're still a human. And I had to learn that. So I actually had an interview recently. And one of the things that I spoke about was having to make that transition to calling them patients. Because at the end of the day, they're still patients, but knowing where not to cross the line. But they are inmates,
Yeah.
So, but I actually took the time to talk to a couple of them and say, like, why are you here? Like, I actually wanted to know their story.
Yeah. And I'm sure they appreciated it because I'm sure everyone just looks at them like the number on, their
badge or ID. Yeah. Yeah.
That's so sad. I mean, I guess it is kind of sad.
Yeah.
But then again, like, I feel like I would be fine with it until it was something that like morally, like I wasn't okay with.
Yeah.
Like if there was like pedophiles or anything, like I'd be like, yeah, I just like, you can bleed.
Well, there was one that like she molested a child, and what can
It's
I
very
do?
different than when it's a female.
I still have to treat you. You're still my patient.
Now, the prison you were in was male and female? Oh, just female.
Just female.
That's even harder.
Yeah. But then when
I
you
feel like women are like even more like conniving, I would say, because they like get on your good side. You feel bad. I don't know, maybe I've watched too many movies, but like.
No, but that's why I'm telling you, like, the first time I ever got called a cunt was by someone who was extremely nice to me. And then when she wasn't getting her meds fast enough, she was like, you never went to Laborae. She's like, you're not even a real nurse, you cunt. And I was like, thank you very much. Do you want your meds?
You're like, here, take 5, you
help
ass. Like, that's insane.
I'm trying to help you. Yeah.
So, I mean, did you have to deal with a lot of pregnant inmates too, and like do a lot of OB stuff? Okay, because I have a friend who does that. She's like,
Actually,
works in OB, but she goes to prisons. And I was like,
no, I think I only in my time there, like, so almost like 2 years, I only saw maybe like 2 pregnant inmates.
oh, that's not. I mean, I guess that's a good thing.
Yeah, it wasn't bad.
I don't think it's like a place you want to
Yeah.
have a baby.
But funny story is that they would be covered with tattoos, and when it was time to like do a blood draw or something, or like a their insulin or whatever, and they would be like the biggest babies. And
Really?
I was like, really? You're covered in tattoos? And they're like, it's not the same.
Well, I feel like it's the anticipation. Like, I feel like when you're getting a tattoo, like, you know what you're getting in for.
Yeah.
You know what it feels like.
Yeah.
But sometimes when you're getting a blood draw, you're like, oh, is this going to suck really bad?
Yeah.
So how do you feel like that? Why did you leave that? Like, were you just over it? Was it just mentally draining, or the hours?
It was mentally draining. And the hours. Like, I was working 3 to 11, 11 to 7.
I used to do that.
And it was just too much. It was just too much. And it wasn't what I wanted to do long term. So
was there a lot of room for like you to grow with that? No. Or it's like you're just a nurse at a prison? A nurse,
yep. Mm-hmm.
That's rough.
Yep. After that, I transitioned into child psych. And I did
scary.
that. So that was a whole nother ball game. Psych seems to just like always follow me for some reason.
Okay.
That became a lot emotionally. Like hearing all the trauma that was going on there. And that was before I became a mom.
I feel like the trauma dump from a child is so much worse being a mom. Like I have 3 kids. Like I can't imagine. You have a daughter. Like it's.
Yeah.
And she's the same age as Olivia, right? She's 4?
4. Yeah.
Yeah.
She just turned 4. Yeah.
That's a lot.
So it was a lot. Just, DCF, like the trauma, the molestation, the everything. It was just so sad. Them being stuck there, like because they have nowhere to go.
That's awful. Because correct me if I'm wrong, there is not a lot of foster cares available. And if they are, they're probably not the safest place for these kids anyway.
Yep.
So they end up returning back to you.
Coming back, yeah.
Where were you for that? What facility? Were you in Salem?
Cambridge.
Not that it makes it any better, but like in the city, it's like, that's so rough.
And they're one of like the few child psych like providers. So I don't think that there's many in Massachusetts, if I'm not wrong.
Is it
like a locked child?
I was going to say, is it in?
Yeah.
Oh my God.
Yeah.
That must be so difficult to.
Yeah, it was sad.
So you go from inmates, which is like kind of sad because they're there. Maybe they did it on their own for the most part, but still kind of sucks. Then you go to sad children that are just being abused. And then was it into aesthetics from there, or did you do something else in between?
No, then I did primary care, like ambulatory primary care. So I was like, all right, enough of the psych. I'm like,
I'm done helping.
I need some stability in my life. And I went into primary care, slowly transitioned into case management, and then now
That's not too bad. Case management for primary care isn't too bad. I didn't know if you were doing like probationary, like cases, like people that are on probation, like checking in on them.
No, once I left prison, I got out and didn't go back.
That's always good. So what was the thing with aesthetics that you wanted? Because I feel like everyone gets into aesthetics for something different, whether it's like they just like the beauty industry, or, they want patients that actually want help versus like primary care. You're telling them to help themselves and they kind of don't listen.
Yeah.
So what was your take on getting into aesthetics? Like why?
So I actually have my cosmetology license as well.
So cool.
In high school, they paid for the whole course. So I was like, well, in case nursing school doesn't work out, let me get my cosmetology license.
There you go.
So I've always had a thing for beauty. And then I realized that I could combine both with aesthetics and do the medical side, but also help people feel nice and beautiful, especially like, I think for me, growing up, I was always very self-conscious. I mean, I still am, as women, we are very self-conscious, but I always struggled with my self-esteem. So I just want to be able to help people embrace what they have and make them feel safe.
I love that.
And I think that also, I personally don't know, maybe I'm wrong, but like, I don't know that many like other Latina injectors, at least in this area.
I don't either.
So I just wanted
maybe a few,
but I don't like.
But a lot of them are Brazilian. The girls that I know.
Yeah.
So it's obviously different.
Yeah.
But
so I just wanted to offer, a different vibe, a different.
Yeah. Well, I also think that like people, and this, I don't think it's necessarily like a race thing, but I think that people generally tend to gravitate to people that they're like.
Yeah.
You know what I mean?
Or people that look like them.
Exactly.
Yeah.
So, or what they want to look like, you know, like you have similar features. You can look like this. I want to look like you.
Exactly.
So I think there does need to be, I mean, there needs to be like one of everybody,
Right.
you know what I mean? No matter what color or whatever, to kind of make people feel comfortable. Because I mean, I've had patients that were Latina that like, you don't get it. And I was like, okay, like I understand what you're saying, but like I can fix you. And now I'm like, they're like, but I'm like, you know what? If you can't come to me, like let me send you to my girl over here. Like, and just as we have this community to send people to places, because and then I have a lot of patients that only speak Spanish. So me and the translator app are like best friends. I'm like, I don't do Spanish anymore. Like I don't. So like, I'll just send them your way. I don't. They're kind of like, oh, I want this, and I'm like, okay. And translator like completely
Google
messes it up, and I'm like, oh my god, this is so bad. I was like, I think this is what you want. Like I'm not too sure. But you've had some crazy ups and downs with your business. I know we've talked privately a lot. So like, what give us for other people? Like opening your business. You opened it after having a baby, which is like literally insane.
Yeah.
Insane. How did you manage like being a mom and opening a business? And then you were still working. Cause you weren't like.
I just stopped working full time.
Yeah. But
Up
weren't you
until
still
this year.
doing case management while you had the med spa too? Crazy.
Yep. So I'd work my 7 to 3. And then start seeing clients at 3:30 because I was working remotely. So I'd like clock out of that and go right into seeing clients.
That's crazy.
So, and I'd pick my days, you know, like my Tuesdays and Thursdays. My partner knew those are his days to pick up the baby. And I see clients till like 7:30, working every other Saturday or every Saturday at the beginning if possible. Now I think this year I really was like, no, I need to spend time with my daughter on the weekends.
Yeah.
Like I'll figure it out. I don't know how, but we'll figure it out.
Was Saturday a busy day for you?
For the most part, yeah.
See, Saturdays are my dead day. Fridays are my crazy day.
Yeah.
And then I'm only in the rooms now on Fridays because I'm just too busy building the business itself and building my team.
Yep.
But Fridays have always been my crazy day, or like Tuesdays. But I'm like, no, everyone has to come on Friday. Like I'm filming on Tuesdays. Like you guys all come on Fridays. But that's crazy. So Saturdays, every Saturday you're working, and then now
Now I pick one Saturday a month.
Do you have staff?
No. Nope.
You're still a one-man show?
Yep.
How's that going?
With
a giant space?
I'm a control freak. Yeah, I have like a whole empty room. That's just, it's been sitting
Why
there for a
don't you hire
year.
an esthetician?
I'm like nervous to take that step.
Okay.
I feel like
Why?
I've worked so hard to have the piece that I have and build the reputation and the brand and the reviews and you know what I mean?
It's definitely hard.
That I'm scared to bring someone else in and have them ruin that.
That's valid. I think it's hard for you too, because for me, being like an fully aesthetic background, I mean, I've trained nurses. So for me, it's a little bit different, but building a team for me was easier because I knew I wanted someone generally fresh from school because I could mold them into like what I wanted and kind of how. But the problem is for you is like, you're
I'm still
not
growing my clientele.
but you're not an esthetician either.
Yeah, either.
So it's like, your focus is the medical. You need to have someone that has the focus of skin and then blend the two and hopefully like it meshes and works.
Yeah.
But I think in order for you to, even for me, like the only way I was able to succeed was like growing my team. And I think eventually you'll get comfortable and want to do that. But it is really scary to like trust someone with your baby. Yeah. Like essentially it's a baby.
Yeah, exactly. So that's what my hesitation has been. And I think also just, you know, as we know, like it takes time to actually be in the green when it comes to doing having a business. And
oh, baby, you're not going to be there for 5 years. I tell you.
Yeah, I know.
Don't
I'm
even
going
bother.
on year 4 and I'm like, okay, it's still negative. What's going on?
Yeah. People think, and this is why I started this show. People look, and especially aspiring nurses, look at some of the people that are my friends. They look at like Audrey Rose. They look at, Dr. Jolie Lehman, who's amazing. All these like Sheena Bay, all these big time like injectors. Talks Josh, who has like crazy stories that he's been coming out with his podcast. Amazing. But you see the glamour and the events and like Evolus throwing these big events. Like I worked for them. Like these events are insane. Like you think like you're at like the Met Gala with these people.
Yeah.
And you see this online and you're like, oh my God, they must have so much money. They're killing it. I'm going to get into aesthetics. I'm going to make all this money.
It's not like that.
And then you get there and you're like, holy shit.
Yeah.
I'm like $500,000 in debt, at least.
Yep.
I have rent every month, insurance. No one's coming in.
And you look at your bank account every month and you're like, okay, I have enough to pay rent.
Yeah. And like there's times, and I'm not going to lie, like there's times I look at my payroll and I'm like, shit, like I haven't done that yet. What do I do? And like you take out loans and you do that. Or you do what every med spa owner does, and I know you did this too. You buy equipment.
Yep.
And you go.
And you think that that's going to help
You're
you
like,
grow.
I'm going to buy this device. It's $150,000. It's going to work.
I'm going to sell 5
Everyone's
packages.
going to love it. And it sounds good on paper. Like everyone sells it nice, right? They're like, oh, if you do 5 treatments per month and you're like 5 people, I can get that.
Yeah.
That's reasonable. And then you're like,
that's how I got caught. Yeah.
and you're like, shit, I can't do one. What's happening?
What's happening? Yeah.
So,
That's the hole I've been in for the last 2-3 years.
is device.
Yeah.
I mean, I've been in that hole for a little sometimes too.
Yeah.
Because you have to figure out what the hell you're going to do.
And I'm just still trying to figure it out.
But I also love the device you have.
No, I think
it works
does
great.
a great job. You know, I had a little bit of trouble with it. I've started to experiment a little bit more with it. I had to take it upon myself to reach out to other providers who have it, like from Florida, Washington, like just anyone I could see and say, what settings are you using? How are you doing yours? Like what protocol are you using? You know? And I've gotten better results. So at the beginning, I think I was like, oh, F this. Like this shit sucks. It doesn't work, you know?
Yeah.
I'm kind of having to like relearn the device.
Well, that's the hard thing too, is this is where I get into like confrontation that's unnecessary with a lot of nurses that come into aesthetics that don't know skin. Like, you know how to inject, that's completely different than treating skin. Yeah. And it's not like, it goes hand in hand, but it's not the same education.
No, and I say this all the time. Like, I say, I'm a nurse. I'm not an esthetician.
Yeah.
So that's why, like, skincare that I carry, like, I don't care. I have Jan Marini skincare.
Yeah, very basic line. Nothing too crazy.
Kits, super simple. Here's a kit. I don't have to worry about breaking stuff down. You need this, and that, because skin is not my specialty.
Mm-hmm. But I think that's where, in some ways, that's where you can grow. I think I read this really good book, and you should read it. It's called Who Not How. Okay. And it's learning how to partner with the right people, not necessarily like thinking of like, how do I build my business? Like, get that word how out of my way. And think of like who I can work with. How am I going to do that? But that does take that level of trust, right? So it's really difficult to get to that. Okay, this person's my who. I'm going to partner with them, and they're going to do really well and build my brand. But I think that aesthetics in general is right now, I think, is very difficult.
And it's just oversaturated because, again, we go back to the point where everybody think it's glamorous and that it's going to be this amazing thing. And like now when I talk to other nurses, they're like, oh, I want to get into aesthetics. And I'm like,
why?
Don't do it.
Well, I also think that there's a big issue that I have is that nurses that have been doing bedside for 30, and there's nothing against you for doing nursing and going to aesthetics. Like that's not what I mean. But it's like you go from nursing to aesthetics and you don't do skin, but that's fine. But then they do one class.
Oh, yeah.
1 day Botox class. And they're like, I'm an injector.
Yeah.
I get it. But like all the people that I know that are very big injectors have spent hundreds of thousands of dollars on their training. Yeah. And it's not like people think you're not going to get that with a 2-day course. Like,
oh, no, absolutely.
You need to do mentorships. Like, I don't think they understand the level of commitment that you have to be successful.
I think also if you're being a safe injector, though. Because I will say, so like I was one of those people. I took Audrey Rose's boot camp weekend course.
I love her though.
But yeah, she's amazing. She was an amazing teacher. You know, I did Botox 1 day, filler the next, and then like the 3rd day was like models, you know, to practice everything. and then you're off on your own.
Yeah.
Unless you're going to make the investment into training more,
Yeah.
like then what do you do? And there are people that aren't scared, I will say, to just be like, I'm going to figure it out. We're just going to wing it.
That is so scary
but
because you and I both know in nursing school, you do not learn the vascularity of the face and like the structure at all. Comparative to what you're doing when you're injecting.
Exactly.
Do you know what I mean? Like you learn basic anatomy, right?
Yeah.
But like you're not learning like a vascular occlusions and all of these things that could potentially go wrong and eyelid ptosis, like all these things that could happen
exactly
on your normal school thing. Or if you're doing bedside for 30 years, like you're not, you know what I mean?
Yeah, exactly. Like, so for me, after doing that, I tried to get into like full facial balancing, but I had a bad experience with like a trainer, and I was like, all right, I'm scared. I'm petrified. I can't do this. I don't know what I'm doing.
Yeah.
And I stuck to Botox and lips. I just stuck to that for a while.
But lips are also difficult. Let's not act like they're not.
Lips are actually much harder than facial balancing.
100%. You have so much, like,
so many more
problems.
Arteries. Yep.
That can happen.
That can happen. Exactly. But I just stuck to those two things to just specialize in. And felt really comfortable with that. And then in the meantime, it's just now. I started in 2022. We're now in 2025 after like 6 additional trainings that I'm now starting to do the facial balancing stuff. I actually just got back from Orlando this weekend.
Yeah, I saw your Instagram.
Yeah. So, and I'm like, wow. He's amazing, Dr. Swift. He was, oh my God.
So good.
I was like, if only I could do that. But now I need to practice.
But the lectures that happen at those conferences are unbeatable.
Well, he broke down the anatomy, like you just said.
Yeah.
Even if you've been a bedside nurse in med surg, let's say, or cardiac, whatever.
It doesn't
for
matter.
30 years, you don't know where all those arteries are in the face.
Because it's not your day to day.
Exactly.
Most of these nurses, and you can correct me if I'm wrong, like their job is to push meds.
Yeah.
And to make sure you're alive.
Yeah.
You know what I mean?
Yeah.
Most of the time.
Yeah.
So it's like you're not doing, I mean, unless you're like in med surg would be my only thing I would think of. Or like working with a plastic surgeon.
Right.
Would be the only way you would consistently see that.
Yep. Yep.
But it's just, I think that where a lot of nurses get it wrong is they want to get into the skin, but that's not their thing. And I think the really cool thing about you is you're like, hey, listen, I have this basic line. They have kits. This is what they say will work for you. You do you, but this isn't my specialty.
Oily or dry? Which one?
Yeah, exactly. What do you feel you are? Like you ask them. But I think that's like admirable of you to be like, hey, I don't know.
Yeah.
Because a lot of people fake it. And I'm why are you faking it?
No.
Let's work together. Like you don't know what you're doing.
Nope.
I do. Let's work together or take a class with me. Let's do it together. Like,
I know
what
you
is this?
talked about that before. You said you can like break it down for me.
Oh my God. Yeah. Yeah. That's like my favorite part is like teaching people that want to learn, that have the background and understanding, because you're seeing these patients are going to start asking you, hey, what do you think about this? And the next thing you know, your phone's blowing up and you have all these things. And you know, now you have Boulevard. I know that you have Boulevard.
Yeah,
now.
I just switched
they emailed me. They told me they're like, she got Boulevard, which is I have to say, I want them to sponsor my show because I literally give everybody the name Boulevard for your booking, and it's the best thing ever. But you have the ability to do so much on there.
Mm-hmm. Yep.
So what are you busiest with now? Just lips and Botox that we're sticking to?
Lips, Botox. So now since I just got back from Orlando, I definitely want to try some of the techniques that I learned. Mm-hmm. So I'll be doing some model calls for full facial balancing. So that I'm really excited about.
I'll come in.
Yeah.
I'll let you inject me.
He was, oh my God, like it's just phenomenal how much, if you're using the right techniques, you can achieve with such minimal filler. And that has always been my approach too. Like people always come to me and they're like, I'm scared that
I'm going to look crazy.
Or I need 5-6 syringes of filler. And I'm like, I'm the last person to be putting that much filler into anybody's face.
Well, I think that people now, the look has changed, right? Everyone before wanted to be like overfilled.
Yep.
You always can tell how things are going to go. Like honestly, the Kardashians are a really good gauge because if you see like big butt, big lips, big things going on, like you know that's what you're going to get. You're going to get a lot of people coming in. They want these obnoxious lips. And I've seen some of the greatest injectors turn people down and it's great that you do. You're like, I just don't do that.
Yeah.
Like, I'm not going to risk the integrity of your face to do that. But then now I think the big thing is like doing Sculptra, doing fillers.
I just started doing Sculptra.
Yeah. Doing biostimulating fillers. That way it's a more natural, achievable look, and it's a refreshed look. It's not a fake, super angular look. And I think the problem too is women were becoming too masculine looking. They were putting such tough,
like super sharp jawline. Yeah,
like it was too sharp. It was too much. Now, granted, like everyone likes a nice crispy jaw. Don't get me wrong.
No, it looks great, but like to a certain extent.
Yeah, when you start to have like the filler bubble on the chin because you want your chin elongated, it just it's not cute, you know. And I think the look is starting to go back
to a more natural look.
Yeah, and like skin and focusing on your skin health.
Well, that's the other thing. Like, so I actually just these last couple months decided that I am making skin more of a priority with the little bit of knowledge that I have.
Yeah, that's good though.
But like I've told my clients now, we can do Botox, we can do filler. However, the actual root cause of the problem here is the aging process, the skin.
Yeah.
So we need to get you on good skincare, or at least some type of. I'm always like super non-biased in the sense that I
use La Roche-Posay. I don't even care. Just use something.
I tell people, I'm like, I don't care what you use, but have a good regimen.
Yeah.
Exactly. I said, it doesn't have to be my stuff. This is what I sell. This is what I personally use. So this is what I like because I can speak for the efficacy of it, you know?
Yeah.
I think it's a good price point, et cetera, whatever. But I'm like, but if that doesn't work for you, then.
Yeah. Well, I also think people don't understand. Like they look at Botox and they're like, oh, my wrinkles are going to be gone. And my biggest conversation with people is like, so if you're relaxed and you have that wrinkle, Botox isn't going to change the crease on your face.
Nope.
It will stop the muscle from moving
to cause a repetitive motion.
Exactly.
Yeah.
But the wrinkle itself, that's surface. That's like chemical peels. That's microneedling.
Yep.
There's so many, and you have microneedling. Like, I mean, there's things that you have in your toolbox, like that you have to offer. But people truly think like they're just so uneducated that they're going to go in and get Botox and they're going to be like smooth.
Yeah. And I tell people that I'm like, if you expect this line to disappear, it's not going to disappear. It'll help soften it, but it's not going to disappear. I've had clients that have told me, you know, like, well, I want to do 30 units and I want to do my forehead, my eyes, or my glabella, whatever, you know, and I tell them politely, I can do this area and this area with 30 units. I think it's best for you to wait. You can come back in 2 weeks if you'd like for your follow-up and do the other, you know, area then, if financially that works better for you, or wait until you can do all three at the same time, you know, whatever.
Yeah.
But like I tell them, because if not, you're not going to be happy with the result. And then it's going to look like I didn't dose you appropriately.
Exactly.
When we all know dosing equals duration.
So I think that what patients also do is they talk online, they see what their friends are doing, other injectors, and they're like, I want this. Well, unfortunately, that might not be for you.
Yeah.
Like your movement might be more than other people. I mean, you're not a doctor. You're not a nurse. Like, why are you telling me your dosage? That's what I think is funny when patients come in and say, you know, this is the works best for my skin.
Yeah.
And I'm like, baby girl.
And
no.
I know for a fact that something that I need to work on, like in full transparency, is speaking with more confidence as the provider. That's something that I've had to work on a lot because I think I always try to think about that, like their feelings. And I'm like, well, I think that this is what we should do. And I need to start speaking like, no, this is what we need to do.
I think that comes from your years in psych though.
I think so.
I think your empathy for them is like you feel bad. Then that's what hinders a lot of business from making money is because they're like, they don't want to say, hey, no, I don't really think you should do this. I always tell my clients, like, you want to look like picture A, like picture B or whatever. Like we got to do like steps A through whatever. Like, you know what I mean? Like if this is our goal, we got to do 1, 2, 3, 4 to get there.
I think that's the other thing though, is that I've realized a lot of people think, oh, I'm just going to do Botox and I'm going to look like this. No. And I've had to start explaining and realizing how much the education, and that's where like the nursing piece comes in, is educating, because that's, you know, one of
100%.
the teaching is one of our specialties, is like teaching them that it's not just a one modality thing.
And it's also not like a one-time thing.
Exactly. Like I just had this conversation in regards to like the filler in college and stuff with my best friend literally on the way here. You know, she's like, I'm scared to do filler, you know, but she's starting to have that break in the fat pads. And I said, okay, well, we don't have to necessarily just start, you know, you're in your early 30s. Like we don't have to do filler now, but we do need to get on top of the collagen loss. Like now, today. Like we can do Sculptra, we can do microneedling, let's do something. Vamp, you know, whatever, to keep that stuff, some radio frequency.
Yeah.
Yep.
Probably one of my favorite modalities.
Yep.
To make it work. I think what people don't understand, and I always explain this to patients, is like when we're born, our face is like an upside down triangle. Yes. Right? So all our volume is up high and then like we taper down. And as we get older, that flips and you get the gauntness. And then you get like this like jowly here. And people don't know that until you really break it down for them and educate them on like what to do. And my biggest thing that I see a lot of med spas do, and even my staff, they go, Alexis, I don't want to seem salesy.
I say that all the time.
And I'm like, you're not selling them. I go, it's like, I mean, you are, but like at the same time, like, I'm not going to sit here and do a treatment to you that's not going to be effective.
Well, that's the other thing. You have to have some type of integrity.
Yeah. Like I just won't do it. Like if I know you need a facelift and you're coming to me and you're like, I want these gone, you need a facelift, honey. Like don't waste $6,000-$7,000 on coming to me for radio frequency. That will help you, but you're not going to get the result that you're looking for. The surgical result that you have in your mind is surgical all day. I can't tell you how many times there's reason why I'm phasing out body is because 90% of the patients that come in that want to do like fat reduction are not candidates for it because they're too overweight. Like we need to talk about diet. Yeah. And are you doing weight loss?
No. Well, personally for myself, I have been doing GLP-1s, but I wanted to do it myself first. Okay. To see my experience before even being able to guide someone into doing it.
I've had amazing results with patients, and our nurse practitioner handles all of it here, but like we kind of obviously cross with everything. But the results we're getting with clients with patients with acne, like the anti-inflammatory effect of these GLP-1s, unbelievable. Yeah. Like all women that, and I do, you know, the ultrasounds downstairs too, like the fertility aspect, all my clients are pregnant or they're getting pregnant. Awesome. They've had PCOS forever. Like do you find that it's helping women with PCOS? 1,000%. In our facility. That's what I'm seeing.
What about the men?
So I don't have as many men on it now. I do notice when it becomes a conversation and they start it, they're so health conscious. And me working with fertility for a long time with people, a lot of it with fertility has to do with the man more than the woman. People think that it's like them, but usually it's the guy. And I have a really good podcast with a friend of mine who has dealt with this. And we actually have a fertility NP coming on, which I'm super excited about. Exciting. But with men, it's getting them healthier. Yeah. So the best way for you to get pregnant, so they say, is for the 9 months prior to you wanting to try, like your partner, your husband, whatever, should really focus on their health to give you like the best swimmers, I like to say. And that way you get optimal results. There is really good data that does say too, and I can link this here, is your symptoms of that you have when you're pregnant are directly correlated to like with the men's sperm, health, right? Or something like that. Yeah. A lot of miscarriages have to do with like the DNA fragmentation. There's a lot of different things that like go into it. But like in my own personal life, I noticed it. Yeah. Like with my my first two, my husband was like he like drank or whatever, and it just wasn't like I was awfully sick with both kids, like terrible. He got sober. He's been sober for like 3 years. Oh, wow. And we just had our third baby girl and I had no symptoms.
The most amazing pregnancy.
Literally no symptoms. So I don't know, maybe was it just like my third kid and like good luck, but like maybe.
Yeah.
But like it really is interesting to me is like before he was not healthy at all, eating crap. And then he went from like eating healthy, you know, physically like working out more, not drinking, you know, not smoking. And like now we had an easy breezy pregnancy.
That's awesome.
So like I think that just GLP-1s help preach the overall health. Yeah. I think the problem with GLP-1s right now though is people think it's a solve all.
Yeah. Well, like my journey with GLP-1s, you know, I've been on GLP-1 since November of last year. Mm-hmm. I've lost only 30 pounds.
I feel like you do look smaller.
Thank you.
Like what?
But I focused on protein and working out. Mm-hmm. Like even with the injuries that I have now, I never let that impact me just because working out for me is like for my own sanity, for my own mental health. Same. So, I modify everything as I need to. But I've been able to only in those 30 pounds, I've only lost 1.5 pounds of muscle.
So that's the big thing is people are just overdoing it and they're getting like full disclosure. Pretty sure the first time I met you was at Lifetime at a spin class. Wasn't Lee like, hey,
I texted you and it was like 6 a.m. and you were like, come. And I was like,
I'm at the gym. Come on. It was Eve's class, wasn't it?
Yes,
Eve's class.
Yeah.
Oh my God. Best spin trainer ever.
Amazing.
Yeah, no, but like you have to prioritize working out, eating healthy. This isn't something that is a, you know, end all be all. There's no skinny pill.
Nope.
No skinny shot. No such thing.
And that's why like I took my time with it and I really wanted to do this like myself and really focus on that because I know other people who have been on it drop 40, 50 pounds.
I dropped 45 pounds. 50 pounds on it, yeah.
But then they stop.
And they gain it all back.
And
I only stopped because I got pregnant. So,
but like, you know, they say 40% of the people who go on GLP-1s, I watched a webinar on this, will gain that weight back.
100%.
Right away. The minute they stop.
But first of all, most of these medications were meant for prolonged use. Okay. That's what a lot of them were anyway. And they weren't initially for weight loss. Now they have indications for weight loss. Right. But I think what people don't understand is that, yes, it shuts the food noise off, but you still have to make good choices.
Oh, absolutely.
Like, you can't just stay on something, get off it, and then go back to eating cupcakes every day and think you're going to stay skinny. You know?
So like even me, like on the days that I take it, the first day, I'm literally not hungry. Like I could go all day without eating, but I make sure I at least get like 75, 80 grams of protein. Like even if it's just a protein shake, a yogurt protein shake, and then like a protein bar, but at least I'm hitting those, you know, those macros.
I don't think the education is there.
And that's why I wanted to do it before I offer something like that, because I really want to be able to give that guidance to my patients.
I think that's amazing though. I think it's good when you do stuff like even myself too. Like I don't roll out a device unless I like
have tried it,
try it, play with it, like try it on myself, see if I do a couple patients that I like. Yeah. Because you don't want to advertise something and like follow the trend and then realize the trend like isn't it.
Yeah.
You're like, oh shit.
And then you're like, oh, here's $100K in debt.
Yeah. Like here's another 100,000. I feel like aesthetics should be the same like acronym as a boat, like bust out another 1,000. I feel like anytime there's something wrong, it's never less than 4 digits.
Yep.
It's never less. I'm like, oh, we need that. Oh,
okay.
That sucks. Or the interest rate's like 11%, like something ridiculous. But I think that people get excited about buying things.
Well, I will say I
know your story and I know, and I'm really good friends with the rep that
I know. So we're going to be very.
No, we can say what it is. It's fine. I think he's cool. He doesn't even care. He'd come on too.
I'll speak on my experience for me. I have a shopping problem.
She's an easy sell, guys.
Yeah. So that was my first problem. And, you know, it's just, maybe it's not just this company. From what I've heard, like other companies too, like they sell you the moon and the stars and they're like, you're going to sell 10 packages in the first month and you're going to have like 15K and blah, blah, blah. And it's not like that.
Well, I think
But also I didn't have the clientele.
Yeah. Okay. So I've been on both sides, right? So
Yeah.
I've been the one selling capital equipment and I've bought capital equipment that has, and it's gone negative for me in some ways too with some devices. I think that their math does make sense.
Yeah.
Like their numbers don't lie.
It does.
You could
for sure.
totally
You
do
sell
it.
5 packages, $2,000 each. There's $10,000.
Yeah.
It's
done.
easy. It's easy math.
But it's not realistic. I think also too, like we also opened both of our businesses right after COVID. I think the market, I know the market is significantly different now comparative to
what it was before.
I also do think, and this is just like a side health note, I think people's skins are reacting very different for people who have had a vaccine versus who haven't. That's not a conspiracy.
Or just in general, what they're eating.
Yeah. Like it's just like they're
People
not
who are
reacting
eating more
the same.
processed food or not eating, cleaner things. It's like they have inflammation, psoriasis, eczema, everything.
The eczema is through the roof right now.
Everything. Yeah.
Through the roof right now. I have never seen more patients with eczema and all of these things than I have now.
Yeah.
And I'm like, it's your gut.
I was just going to say,
Let's
if
look at your
there's
gut.
one thing that I could get into like now that I would like to kind of niche on is like gut health.
I love it.
Gut health, because I'm one of those people that like, I'm stressed. I can't go to the bathroom. Like I'm nervous. I want to throw up. Like everything for me starts in my stomach.
Super sensory.
Yeah.
Well, we do the gut health tests, like the stool sample tests. We do them here all the time for people's skin.
Cool.
And like my nurse practitioner reads it. We go over it. The cool thing is I've been doing this so long that like my nurse practitioner, like we go over it together and she's like, Lex, like you know more than I do. And I'm like, no, I'm not trying to be that person. But like, I just obsess over it. Like, I'm like, I need to know everything.
Yeah.
But I think the gut health testing is huge. But to get back to device, I think that when they sell you the bill of goods, I think that they do have your best intentions for you. I don't think anyone does things to be malicious, because let's be real, all this stuff works.
Yeah.
All these devices do work. The science is generally the same. They're not far off. They're just in a different pretty packaged box, and they range from $50,000 to $100,000 in different of price.
Right.
Like they're all generally the same. Whether you have Morpheus, whether you have skin, Pixelate, you know, whatever you have, like they're all the same thing. Now the big thing right now is like the Cyton BBL Halo. Like, okay, if you have an Erbium, like you can build the same results with any devices that generally that you have out there. The science is the same, but it's how you market it that you get it. I think that people aren't putting the money in the big ticket items right now. And I think the problem with that is now everyone's like undercutting each other.
Yeah.
And that's where the problem is happening. Because essentially you should be able to sell packages for $2,000.
I think for me to kind of like, I guess, narrow it down, I've realized, and this is just something I've noticed general in aesthetics, is that, like you said, everybody's trying to beat each other with pricing and stuff. I have just come down to the conclusion that I'm going to focus on what I'm doing, what I offer to my clients, because if I continuously try to compare myself to, oh, well, this one's selling for $8 a unit and this one is doing filler for $250 half a syringe, like I waste so much time. I would waste so much time these last couple of years until I really like a light went off in my head that I was like, you just wasted an hour of your life that you could have been doing something for your business, scrolling on Instagram, trying to see how to make a better deal than the person down the street.
Yeah. If you focus on you, and I always say the biggest difference between myself and the person down the street is I will always do more education, do more.
Yes. Yep.
I don't want to be the smartest. I hate the saying like I don't want to be the smartest person in the room, because I always want to learn.
Yeah.
But when it comes to like my patients, like I want to be the authority for their skin. Like I don't want them to go anywhere else. I want to sit with them. I want to do, and this is where the power of consultations comes in.
Yeah.
Because I think that's where you can shine and anyone can shine.
Yeah.
Because you can say, listen, this is about educating you on what's best for your skin, for what you're trying to go for,
Yep.
and then go from there. Because
Yep.
if you are that authoritative figure, they're going to spend their money with you. And they should, because you know what you're doing.
Yeah.
You know, people that are just throwing out a deal for $250 for half a syringe, I question your education.
Yep.
Because I don't know. But for me, like, I turn down more people than I take in.
Yeah.
And that's probably like a really bad business move. That's probably something people shouldn't do. But because I'm not going to do something that's going to ruin my reputation.
Yeah. And I think, like you said, teaching and education are huge. Like and that's where I take a lot of pride, like I said, and it's hard for me to let anyone in or even grasp the idea of doing that, because if you look, at least like for my reviews, all my reviews are, she took the time to explain. She took the time to educate
5
me.
stars, baby.
She didn't, yeah, exactly. Like, she didn't rush me.
Yeah.
Every person that comes into me for the first time, I give them an hour of my time. I mean, that's also why I charge for consultations, but.
Yeah. But I feel like you should, because your time is valuable. I don't think the idea of a free consultation, like, I like that, but I also realize, like, I have lost thousands of dollars doing free consults.
Yeah.
I still do free consults just because a lot of the times I book my consults and then I book one of my staff members in my consult with me.
Okay.
And I'm like, you guys are going to listen to how I'm going to talk to this patient, because I know 90% of the time.
At the same time.
Exactly.
Yeah.
I know 90% of the time people are like, I want to book with Alexis because she's the owner.
Yeah.
And I'm like, well, I'm not in the rooms all the time. So, like, you need to love one of my other girls, but I'll do the consult. How about that? And then they're like, oh my God, I didn't even think of doing that. And I'm like, yeah, here you go. Yeah. So it's just a help. And I think that you could do the same thing if you wanted to.
I think I need to streamline things in my business a little bit more.
I'd love to help.
I think I was also trying to be a jack of all trades, which everybody tries to do when they first start. They want to do this and do that. And
I think they do that because you want to make money and you're nervous.
Yeah, absolutely. But now I'm like, okay, I don't want to do everything.
Yeah.
I can't do everything, especially being a one-woman show.
Yeah.
And I want to kind of pick my 4 or 5 things that I'm good at and just stick to that.
I always say to everybody, when you go to a fine dining restaurant, is there menu pages?
No,
It's
you're
a
right.
single page.
Yeah.
You have a few apps,
Simple.
few entrees, a few desserts.
Yep.
And then it's like very a la carte. This is what you do, whatever. It's not like the 99. You don't want to be compare the food. You know what I mean? So I always tell, be the fine dining restaurant.
That's a good analogy. I like
narrow
that.
down what you're doing.
Yep.
And focus on those and be the best
That you can be
at those things. And that works.
Yeah.
Now for me, when I first opened, I made the same mistake. I bought all of this shit. And know what's funny is, like, I know better. Like, I know better. And I still did it. So it's like, it's a good deal. Like, I'll throw it in.
Feel better.
No, but I know better. And I still made mistakes in purchasing. But you know what? I think that everyone makes mistakes. You learn from them. I thought I was going to do a lot of body. I had a lot of interest. I didn't want to do it. I just don't want to do it. So we took it off our menu.
Yeah.
Like, we do body in the sense of, like, we have a massage therapist and, like, different specialties. But, like, I'm not doing, like,
body contouring
as much, unless it's, like, lymphatic massage type stuff. Like, we're not doing that anymore.
Yeah.
So I cut that out. I was like, let's cut this out. We don't need, trim the fat. Things that aren't working, trim them out. Let's focus on the things that are working. For you, Botox and lips work. Like, be the best lip injector. You know what I mean?
Yep.
So I think that's what I always just, like, my little pearl of advice for everyone. I'm like, don't be a 99.
Yeah.
Nothing against a 99, but, like, like, you don't want to be like kitties, I guess, like a million things on the street, like a million things on their menu. It's not that it isn't good, but, like, a fine dining restaurant excels at the small
things that they do.
That they do. And that's why you go there. And that's why you pay the price.
Yes. Yep.
If I'm the best, you pay the price.
Yep.
So that's my little pearl of advice for people today. We can clip that into something. So where do you see your business going? Like, what's our goals? I
want to go back to school.
Ooh, get your NP?
Yeah.
Love
I want to
it.
be an NP. So I need to do that sooner rather than later.
Yep. takes a little bit of time. My friends have been doing it. They said it's like not as terrible.
That's what everybody says, because I've been out of school since 2014. So
yeah, they said it's really not that bad.
God, going back to school, tests and this and that. And they're like, no, it's just a lot of papers, like papers, reading.
Are you doing it because you want to be your own medical director and you want to do it that way and you want to medical direct because you can in the state of Mass? Or do you want it just for like the authoritative thing?
I want it because it opens so many more job opportunities, in the sense of like I can work 1 or 2 days as a nurse practitioner. I also...
So you don't want to do it full-time, aesthetics full-time. You'd rather...
I do. But I think that I don't want to leave the
field. You're scared.
The field, yeah. I'm still scared to make that transition. So in my mind, it's like to be able to do both.
Okay.
But I also feel like I have so much to offer as a bilingual, almost trilingual nurse. You know, I speak English, Spanish, and then I also speak Portuguese proficiently. Like I can have like an actual conversation with someone. So I feel like I can be a good tool in the actual healthcare system, especially as a nurse practitioner. You know, I actually don't love the idea of prescribing. It scares me. To be responsible to prescribe medication to somebody. So that's something I'm going to have to work on if I do plan on being a nurse practitioner. But the autonomy that you have is what I like. I love having autonomy. And then I don't see having a medical directorship program in the future right now. I don't think I want that responsibility as of now. I mean, I could change my mind maybe.
Yeah.
Down the line.
I think just by talking to you, I think for you, it's mainly just like to have that autonomy, not have someone over you.
Exactly.
And then being able to help people because you have so many superpowers and being able to like speak so many different languages. Like you can, you know, empathize with people and help them in different ways.
And that's, like
I love that.
I don't feel like I need to, like, I can have a super successful business, you know.
You can have that too.
Yeah, that too. But I can have a super successful business and I don't have to be, you know, injector bunny, or I don't have to be like this huge thing, you know. I can, and it's great.
Well, I think that's what people assume that everybody wants. Everyone wants to be lip bunny.
Exactly. And like, their business.
Nothing against her.
No. That's what I like. Nothing against. Like, that's amazing.
That's just not your jam.
And
that's fine.
I like to keep to myself.
I think that the best thing that people can do is just to be authentic and be them. And if it's not your jam and you just be honest with people, I think that's where like you will excel. I think it's when people pretend to be these big boy injectors. They pay for followers. Like the paying for followers thing, like I'm over it.
I didn't even know people did that.
Oh my God.
Like I just
pay
found
for
out
likes.
like last year that people do that you can pay.
I've never paid for a like ever. Ever.
I was like,
why would you do that? I don't care if I post and it gets 5 likes. I don't give a shit. It's the fact that you do it. It's the fact that, you know what I mean? Like, obviously you want your stuff to go viral and you want things to look good, right? You want a lot of subscribers and all the things. But like, I'm not gonna like ruin my integrity when it comes to like, you know, myself, when it comes to just saying things or doing things because I want to fit the mold of what people think. Like I'm not gonna do that.
And I think that that's what like I cherish and value so much, is the integrity that I know I offer. Like I can sleep at night.
Exactly.
Knowing that I have not ripped anybody off, that I have done the best that I can do, that I have been the safest injector I can be at all times, that I have done the most, you know, sterile, or not sterile, but like cleanest, you know, safest environment that I can for patients.
Yeah.
And I can sleep at night.
I think the other thing I've been hearing a lot is like a lot of injectors that are big that are leaving injecting because they're like, I'm making all my money off you body dysmorphic women. And that's where I'm making my money. And I think the difference for you is that you can talk to them from a psych standpoint and be like, hey, listen, we can make these marginal changes, but like, it's not going to change how you feel. If all you see is bad.
Right.
You know, we can tweak things here and there, but I can't change you.
Right.
You know what I mean?
Yeah. And I have patients that are like that no matter like what we do, they They're like, well, we still need to lift a little here and a little here. And I'm like,
Yeah.
well, this is as good as we're going to get.
Sorry.
Sorry, but I'm not a surgeon. Like,
Yeah. You don't do threads, right?
I do PDO smooth threads, not lifting, because I'm still getting comfortable with the smooth threads. Again, I'm very honest with myself. Like, and that's what I like, going back to the integrity. I take pride in that. If I don't know how to do something, I tell my clients, I'll look it up. I'll learn. If I feel safe enough, we can try it, but know that this is my first time doing it. Do you feel comfortable with that?
Yeah.
Yes or no? Yep. Let's see what happens, or nope. All right. Well, at least I'm letting you know, like, I've never done this before,
Not to like push you in this direction, but total plug for PDO. Afterglow is bomb.
So
for
they
your
sent
clients,
me a sample.
Oh my God.
It's in my drawer.
I
still need to do it.
Stop.
On myself.
Stop. It is my favorite. My favorite booster. 100%.
Have you tried Vamp?
Yeah.
Better than Vamp?
I love it. I like it because I like their stamper. You can use, they have like a pump one too.
Yep.
But I like that it just attaches
the little
to
pin one?
Yeah, it attaches to a syringe, which I love because then you can like know what you're doing and like I can put more in one area than the other. You're not like hoping it gets in because a lot of these stampers, like you just put it in and like you go.
Yeah.
This being on the syringe, I feel like you have more control.
Okay.
But you can buy the pump one. It is really cute too. But I love the PDO Afterglow. It is unbelievable. It works amazing. It's not like a crazy price. I mean, I charge for just the PDO Afterglow, like just the treatment itself is $375. So it's not like too crazy.
Yeah.
And we do deals on it all the time.
Yep.
And it is probably one of my...
Is there downtime with that or no?
No. That's why it's one of those things that you could do the same day you do your injectables and they leave with like a beautiful glow. Because no one wants to leave bright red and looking crazy.
Yeah.
But that's something you might want to try.
Microneedling.
But to the stamping.
Yeah.
Because you're not going to be bright red. Like I'm going to do mine today.
Okay.
Like it's one of those things that it accompanies with injectables so beautifully. Like just like, to plug them because I love them. Jackie Luongo is one of my favorite people. So
like I like to combine the no downtime glycolic peels from Jan Marini right before the Botox because it just gives them such a beautiful glow.
Love that. If people leave glowing and not looking like a tomato, they're totally gonna do it. So I ask everyone at the end of my show, if you could give a business owner in your position some advice, what are like 3 things that you live by that either help your business grow or just advice for them?
I would say the first one is find a mentor. Find a good mentor. Someone that you genuinely trust. Like that you don't feel any questions or like iffy that when they tell you something like, are you really being honest with me or not? That type of thing. I've been very blessed and very lucky to meet people early on in my business entrepreneur world life that have been like angels to me, honestly.
I love that.
And I think that also just because I'm so, I like to say all the time, divinely protected, by the universe, by God, everything. So for me, it's like they've been true gifts and have been amazing teachers for me. So someone that you can count on, someone that can be a mentor to you. Number 2, don't buy the device without the clientele. Like we said, they're not bad, but just make sure that you actually have the clientele before you buy a device.
Test it.
Yeah. See.
Feeler.
Yeah. Definitely don't jump into getting a device. Like specialize in other things first. You can bring the device in after.
It's never going to go away.
Exactly. And the deals are always going to be there. So.
And what's one more?
One more. Be humble. I think be humble and have integrity at all times. It's not about the money. It's at least for me, it's not about the money. Like, I tell people all the time, like, and maybe it is because I was working full time. So it was like that wasn't my paycheck, but like, for me, it's like, it wasn't about the money. It was about what result are you getting? Are you going to be happy? Or are you going to come and complain to me 5 more times when you leave my chair?
That's the worst.
Like really make sure and document document.
Awesome. Well, thank you so much for
Thank
coming
you.
today. And I hopefully you come back and
Yes.
we'll do like a little 6 month recap and see how our business is doing. Full
see
follow-up
where
episode.
I am.
Awesome. What are the socials that people can follow you on?
RX Beauty Room
Love
is my
it.
Instagram. RX Beauty Room on Facebook and rxbeautyroom.com for the website.
Awesome, guys. So we're going to link her below. If you have any questions or you'd like to book an appointment with her, she'll have her link there and we'll catch you next week.